Alright, so for the next aspect which we are going to discuss this morning is the active management of labor. Labor could actually go on naturally, but sometimes, you have to ensure that the labor is going on well. You have to ensure that things are actually going on as planned, okay? So that's where the active management of labor actually sets in. So for the active management of labor, we'll talk about all the components of it, okay? So active management of labor is just structured approach to childbirth. So it's designed to reduce the duration of labor and minimize any complications that usually come up in labor, especially in first-time mothers, okay? So it was pioneered in Dublin in the late 1960s, and since has influenced obstetric practice worldwide. So what are the key components of active management of labor? Early diagnosis, So labor is usually confirmed early, okay, often by a midwife or a doctor. So the continual monitoring for, vaginal dilations, okay, 3 hourly, okay, so or 2 hourly, you understand, just continuous management. Then amniotomy, this one, if the membranes do not rupture, they can just artificially rupture the membranes, right? Then oxytocin augmentation, this one, they can give oxytocin just to aid the stimulations and make them much more faster. Supportive care, this is psychological and emotional support is emphasized, okay? Then they can also use epidural anesthesia just to relieve the pain, okay? So third stage management is after delivery. They can administer oxytocin drugs, controlled contraction to deliver the placenta, fundal massage just to reduce the postpartum hemorrhage, that's bleeding after delivery. So the goals of this active management of labor is just to keep labor within 12 hours, right? It shouldn't be going too long, okay? To reduce any, surgeries to deliver the baby, so that delivery could actually go through the vagina naturally. Also to minimize maternal and neonatal complications, okay? So that's just it for the active management of labor and the various components in this practice.